Hi, my name is Savannah Sullivan, and this is my informative speech. Have you been feeling more stressed out or anxious during the pandemic? If you have been, you are not alone. In fact, according to the website of the Centers for Disease Control and Prevention, a government study conducted by doctors from June 24th to June 30th, 2020, found that 40% of adults in the United States reported an increase in mental health conditions and substance abuse, as seen by these statistics. Now more than ever, it is important to be informed about mental health resources. Today, I would like to inform you on a helpful resource. Since I have a strong interest in art and psychology, I explored how I could turn that into a career, and my research led me to art therapy. I'd like to inform you on what art therapy is, how it works, and what conditions it benefits. First, let's talk about what art therapy is. Art therapy is defined by the American Art Therapy Association. According to the American Art Therapy Association's website, accessed on November 24th, 2020, art therapy is defined as an integrative mental health and human services profession that enriches the lives of individuals, families, and community through active art making, creative process, applied with psychological theory and human experience within a therapeutic relationship. Art therapy is facilitated by a professional art therapist and was founded by Margaret Naumburg in the United Kingdom in the 1940s. Art therapy takes place in many different settings, including hospitals, clinics, and shelters. Art therapy can also be used as a private practice by a professional art therapist. Art therapy is helpful for all age groups, including children, teens, adults, and elderly people. Now that you know what art therapy is, let's talk about how art therapy works. Art therapy combines art with psychotherapy. Patients use art to express themselves and work through feelings. Any type of art is used in art therapy, including painting, drawing, collage, sculpting, clay, doodling, or coloring. This is an example of a coloring sheet an art therapist might have a patient do. Creating art decreases mental health conditions such as anxiety, stress, depression, and improves well-being, which is why art therapy is very helpful. A 2017 research study led by Judy and Christine Tiger entitled The Effects of Coloring on Anxiety, Mood, and Perseverance, and published in Art Therapy Journal of the American Art Therapy Association, found that free choice coloring was effective in reducing anxiety and stress levels and improved participants' mood. Psychotherapy is used to discuss the patient's artwork and what it means. Art therapists and the patient discuss what objects, colors, and people who are present or not present in their artwork. Patients work through conflicts and gain insight into feelings through their artwork, and the art therapist uses psychotherapy to help them talk through it. Now that you know what art therapy is, how it works, let's talk about what conditions art therapy benefits. Art therapy benefits many mental conditions such as anxiety, stress, autism, dementia, depression, eating disorders, trauma, and substance abuse. Art therapy helps manage stress, understand feelings, and improve conflict resolution. Art therapy is also beneficial to physical conditions such as traumatic brain injuries, cancer patients, and patients with pain. According to a 2018 research article by Tamara Shella entitled Art Therapy Improves Mood and Reduces Pain and Anxiety when Offered at Bedside During Acute Hospital Treatment, which was published in the journal Arts and Psychotherapy, patients given art therapy had significant improvement in pain, mood, and anxiety levels regardless of age, gender, or diagnosis. In conclusion, today I have informed you on what art therapy is, how it works, and what conditions it benefits. Art therapy is being used for both patients and healthcare workers. In fact, WFYI journalist Lady Noon wrote an article in April of 2018 in which Dr. Bob Pascuzzi, chairman of neurology at the Indiana University School of Medicine, states that patients who experience significant stress, depression, anxiety, mood, and fear benefit from art therapy, and this is why he has started an art therapy program not only for his patients, but for IU health workers in his department. Art therapy might be a helpful resource for you or someone you know. As famous artist Vincent van Gogh once said, "Art is to console those who are broken by life."